Welcome to Complicating the Narrative, a podcast that takes on the challenging questions in public health by embracing complexity rather than avoiding it. I'm your host, Salma Abdullah. This episode is part of the Purple Public Health Project. Each month, the project takes on a question that we think public health needs to engage with more productively. The goal is to build a field that can hold real intellectual diversity and still serve the populations it exists to serve. This month's theme is autonomy, and the question of when, if ever, public health is justified in restricting individual choice in the name of population health. My guest is Dr. Justin Bernstein, an assistant professor in the Department of Philosophy at the University of Virginia. Justin is a co-author of the Stanford Encyclopedia of Philosophy entry on public health ethics. We talk about the difference between autonomy, liberty, and types of freedom. We work through his critique of liberty-based arguments against pandemic lockdowns, including the distinction between liberty interest and equality interest. We also engage with his case against libertarian defense of vaccine mandates and what it means to take an argument seriously enough to follow it where it leads. We close on the harder question underneath all of this. When public health restricts individual choice, whose values are shaping that type of policy? Justin, welcome to the podcast.
Thanks for having me, Salma.
I have to say, I interviewed two philosophers in 2 days, back to back, for two different projects. I'm
my
learning.
Condolences.
No, it's been challenging in the best way possible. I thought argument at the hospitals with other physicians might be hard, but it is very helpful to speak with a philosopher because I think it helps you make your argument more precise, hopefully, or it forces you to do that. So some of the conversations we were having in preparation for this were around us framing this month as a discussion on autonomy and public health. And something you brought up that I had to go back and look up more is that usually autonomy is brought up when we're thinking about individual to individual relationships, so bioethics, patients-clinicians relationships, which made me realize it might be helpful for us to just define some of the terms that we're using today. So the first one would be autonomy, and another term that we discuss is some of the work we reference, Isaiah Berlin's work on freedom to freedom, from negative freedoms, positive freedoms. So can you take us through some of the terms that you think might be helpful for this conversation today?
Sure. So autonomy just means self-governance or self-rule, literally. And there are different kinds of dimensions of autonomy and different sorts of threats to autonomy we might want to talk about. So some sorts of threats that you're really focused on in individual ethics have to do with cases where the person has compromised autonomy due to sort of addiction, internal factors, compulsion, things like that. So the person who's in the grip of a really severe addiction, we might say they're not self-governing, they're being governed by this really extreme desire. But when we're thinking about public health, we're typically more interested in external circumstances or obstacles to self-governance. And those can kind of come in two forms. One way of thinking about it is in terms of interference with your negative liberty, as you put it. So Isaiah Berlin draws this influential distinction between positive and negative liberty. Negative liberty is basically freedom from interference. So my freedom to say what I want without others interfere with me is a kind of negative liberty. My freedom to practice my religion without harassment from the government, again, negative liberty. But we also care about freedom too, or positive freedom. This is sometimes associated with Amartya Sen, people in the developmental economics literature, also known as the capabilities approach. Where we're more concerned with what people are able to do. So there's a sense in which, there's this old line about how I forget which Marxist said it, but it's like, in the capitalist society, we're all free to choose which bridge to sleep under, right? That's a case where we have lots of freedom from, but no freedom to. And so, how you think about the balance between those two things, to what extent can we infringe upon freedom from in order to ensure people enjoy freedom to various kinds of things, is a central sort of question in theorizing about justice and legitimacy and other kinds of political concepts.
So then we say in our article, Sandra and I, that freedom to and freedom from are equally important. And you disagree with that. So why do you disagree?
Well, it's not that I necessarily think it's false. I just think that this is where you get a lot of dividing lines in political ideologies. One way of thinking about it is that there are different strands of liberalism, not as in, the Democratic Party in the United States, but the liberal tradition going back hundreds of years to whoever you want to date it to. So you have what you might call sort of left liberals and more kind of classical liberals, and then other folks that I think we'll be talking about. So classical liberals, tracing the roots to people like Adam Smith, they emphasize negative liberty. freedom from. So they say, what liberalism is really about is letting people to be free to go about their business. In the case of Adam Smith, there's a lot of talk about the invisible hand. There are reasons, they think, not to have government be overly involved in trying to ensure that people have freedom to certain kinds of goods and services. Now, I mean, Adam Smith wasn't saying that people should be allowed to starve to death on the streets, but the thought is we should leave a lot of the stuff that contemporary governments do to private markets. Left liberals, you could think of, say, like the 20th century philosopher John Rawls, for instance, is probably the most influential version of this. They put a much greater emphasis on the state providing people with various kinds of means or opportunities to enjoy what we've been talking about as positive freedom or freedom to. So, for instance, Rawls argues that a principle of justice is that the state should ensure that people who are similarly talented and motivated should have similar life prospects. And to ensure that, we need to make sure that people have access to equal educational opportunities and subsidized medical care and things like that. So you can take a number of different stances about where freedoms from and freedoms to should stand relative to each other. Basically, all liberals agree that we can't sacrifice certain core negative liberties or freedoms from for the sake of realizing various kinds of freedom too. So you can't just restrict people's freedom of speech or freedom of religion, even if that might lead to greater employment opportunities. But within that family, there's large disagreements about the relative importance of the two.
And I think this brings me to your lockdown paper. I have to say, throughout your papers, it was fun, fascinating to read philosophy papers because you just go after the person you're arguing against. I think at least that was my impression.
Yep.
In public health or medicine, I'm trying to write something now about trust, and someone wrote something I just fully disagree with on trust, and I'm trying to find the most polite way to bring up what they said without actually naming them. So I found that to be very refreshing. You're just arguing against the other person, but here you are assessing the case in the lockdown paper with your co-authors using liberty interest as a way of arguing against lockdowns. And that one was interesting to me for multiple reasons. But I think let's walk through the paper first. What were you trying to achieve in that paper? Because I think part of it was negative freedoms versus not. And I just wondered also, like, where do we draw the line between saying, like, you can't do this thing where it's like you can't open your business because of the harms that might come to others. I'm particularly interested in the liberty versus equality aspect of that discussion, but we'll get to that later. Can you talk a bit about that
Yeah.
paper? Yeah.
So this paper just came out recently. So the goal of the paper was to sort of articulate and assess various kinds of liberty-based objections that were raised to lockdowns during the COVID-19 pandemic. And we'd seen in various other people had kind of gestured at these liberty-based arguments, and we wanted to dig a little bit deeper maybe, or engage at greater length with some of the arguments that had been put forth. And so we talked through, I think there are 4 different kinds of arguments that we go through. And we suggest that in each case, the sort of liberty-based complaint against lockdowns is not as compelling as it might seem, that the arguments in question are either incomplete, they need additional work to sort of show that lockdowns unjustifiably infringed on liberty, or the argument was just flat out unsuccessful. We're not saying because of this that lockdowns were necessarily, all things considered, justified. We think that there are lots of grounds on which you could object to lockdowns. So liberty is one ground. Other grounds might have to do with for instance, you might think that they were unjustifiably ageist given the sacrifices that younger people had to make in order to protect older people. Or you might object that the lockdowns did not really do enough by way of getting sort of input from the public. So something I'm working on now is thinking about how should the public be engaged when it comes to really monumental decisions like a lockdown. And governors were given extraordinary powers in the United States. We might think that wasn't really appropriately responsive to democratic demands or something like that. Or you could just say, the effects overall, the harms were just greater than the benefits. So there's still a lot of objections you could raise to lockdowns. We're just saying the liberty-based case is actually far less compelling than you might think once you look at it more in depth.
And so the particular liberty versus equality interest, can you walk us through that? I find that distinction to be very helpful, but it would be helpful also to examine it through other lenses, not just lockdown lenses. So what did you mean by that?
So one of the arguments that people make against lockdowns is that on a liberty-based argument is that basically by allowing the government to implement lockdowns, we're giving them this great power that they could potentially abuse and overreach in a form of sort of government overreach. And we can point to examples in our history, really like terrible episodes of our history where governments did use emergencies basically as pretexts to use powers in ways that are deeply unjustified. So the key example that often gets invoked in this case is the internment of Japanese Americans during World War II and the case of Korematsu. So I'm not the person with the law degree who was helping write this paper, but the basic idea is this. It's a mistake to frame the decision in Korematsu and the problem with internment of Japanese Americans as primarily a restriction of people's liberty as such. What really matters is that it was used as a form of kind of discrimination that targeted Japanese Americans. So it's not the liberty per se that's at issue, it's that people were treated in this deeply discriminatory fashion. And so that's the basic idea, is that liberty interests are just about our interest in being free to do certain things, whereas equality interests are interests we have in being treated as equal citizens to everybody else. And so we argue that really the cases of overreach in the context of emergencies that people point to when they claim to be making a liberty-based argument all kind of point to these instances where individuals are being singled out on the basis of basically ethnicity or things like that. So another example would be post 9/11, a lot of the surveillance measures that targeted Muslim Americans, sort of Islamophobic sorts of things. So our thought is that the really kind of most worrisome overreaches on the part of government when it comes to these emergencies really have more to do with restricting people's equality interests or unjustly discriminating against certain people rather than others. And we do think that there are reasons to worry about this happening during, say, the COVID-19 pandemic. So in some states, casinos were allowed to be open before churches were. That seems like maybe that's not a case of treating religious people's interests as on a par with non-religious people's interests. Or to use another example, there were restrictions on elective medical procedures, and in some states that was used to restrict people's access to abortion services. Now, to us, the issue there is not that the liberty to go to church was restricted or the issue to get access to reproductive services was restricted. It's that it was being targeted against these particular people in a way that's deeply unjust. So I mean, it's objectionable, but it's not primarily about the liberty per se. It's about unfairly targeting certain kinds of groups.
So does this concept then travel beyond emergencies and pandemics? Can we think about the liberty versus equality interest in other settings? So, for example, we use SNAP benefits and restricting smoking in public housing as two examples in our essay. And some of the argument there, at least for public health, is that, well, people who are in public housing usually also have some of the highest exposures that lead them more vulnerable to cancer. And then banning smoking in public housing is also good because usually public housing share a lot of insulation with other houses. But sometimes we see this, even if the structure doesn't really justify saying, oh, whatever you do in your house might affect others who are living in public housing. If you live in public housing, you just cannot smoke. That is just the requirement. So this is one case where I wonder if we're thinking here, does equality interest apply or not? The same also with SNAP, because I'm trying to wrap my head around this because it applies equally to everyone who lives in this area. SNAP and also the same. So SNAP benefits, a lot of states say you can only use them for certain type of food. But in a way, equality interest, at least from my reading, seems like it doesn't apply because this is a rule for everyone who's under this specific issue. But does it also apply if we think about others? We're not telling a private individual, someone like me, no one is telling me what I can buy or not buy with my money. So I was trying to see if this type of argument applies beyond emergencies and pandemics or not.
Yeah, so I mean, the way I would frame it is slightly different, mainly just because we're thinking about liberty interest versus equality interest, partly in that section because we're interested in sort of constitutional jurisprudence. And I'm more of a philosopher, but the way I would think about those sorts of issues. So I'll start with the SNAP with food stamps. I think there's a real worry that there's something deeply disrespectful about telling people you can use this food assistance, but only for the kinds of things that we tell you can use it on. So telling people that you can't buy this food, but you can buy that food. There's something paternalistic about that kind of decision. And so that would be kind of the objection I would raise there. It's one based sort of on respect and what you're expressing and not trusting people to make their own decisions. I mean, you could talk about that in terms of a kind of stigmatization, and
Mm,
stigmatization obviously runs afoul of requirements of equal respect or things like that. So that might be the
mm.
way that would appear. With regard to the smoking case, I mean, maybe I'm not fully understanding the example, because I would think that the smoking case, I mean, once you have harms to third parties, then we can say, well, you're not allowed to harm third parties, right? So the reason why, I mean, it became much easier. I mean, as I don't have to tell you this, but like in the United States, regulations of smoking became much easier once we learned about the dangers of secondhand smoke, right?
Yeah.
Because then you can just appeal to, well, if you're a consenting adult harming yourself, that's one thing, but you're harming these other sorts of folks. So it seems like if that's what's going on, it seems like a relatively straightforward extension of other kinds of, sort of harm prevention arguments, harm to non-consenting third party arguments that we make for restricting smoking in other kinds of spaces.
No, that's a valid point. I think my worry there is, what if we say to people, we apply the same argument for people who also have detached units that doesn't necessarily have any
Mm,
access to others. So would the same argument then apply to those people? Because basically
right, right.
the only issue they have is just they live in public housing.
Yeah, I mean, it's sort of like, well, I mean, to say that, well, you can't do this because we're paying for it, making sort of strings attached, again, sort of seems to be treating these individuals differently than we treat everybody else in our society. I mean, we let people who buy their own homes smoke cigarettes in their own
There's
homes. So I guess it's not really clear what the rationale would be, other than a kind of paternalistic judgment that we don't think you're capable of making the best decision for yourself, so you shouldn't be free to smoke. Yeah.
yeah.
Again, stigmatizing kind of things going on.
So then, how do you feel or think about taxes for sugary drinks or beverages? Because on their face, they are something that is affecting the entire population. If we ask an economist, they are regressive taxes, right?
Yep.
Because they impact people with lower income much more than other groups in the population. So how would you consider them, looking at the different frameworks that you just spoke about? Where would those fit as a public health intervention?
The way I think about sugary tax beverages is the worry about regressive effects is a pretty valid one, I would think.
Mm,
So one further way of building the sort of case for the regressive effects kind of argument is looking at which kinds of beverages actually get counted as sugary beverages. So like frappuccinos, which have a really
yeah.
high sugar count but aren't stereotypically consumed by people from lower income backgrounds, like those aren't taxed in the same way. So it's not really just about sugary beverages, right? So I think there's worries about respect and expressive harms there as well. I mean, I think it depends on what your rationale is. It makes a big difference. So if you're just saying, well, we live in a society, not the United States, but we could imagine a society like a more European one, where you say we collectively bear the costs of everybody else's healthcare by choosing to engage in certain kinds of unhealthy behaviors. You're basically imposing a negative externality on the rest of us, and we're just trying to offset it. That's one kind of argument. But if it's just about promoting population health, preventing people from making decisions that are unhealthy, I think that's a lot more fraught. It's a lot more fraught partly because it's sort of making judgments about the importance of health relative to other kinds of goods that are at stake. So people really like sugary beverages. There's cultural significance with sugary beverages for various people. It's something people enjoy drinking with their children. And to say that, the negative health effects outweigh all those other kinds of values or interests that people have is making a really strong contentious value judgment in a
Mm,
way that's, sort of, well, you're free to live your life, but you just can't impose negative externalities on the rest of us, is a little bit less fraught,
hmm.
if that makes sense.
This is, I think, that the hardest part for me, because I agree, and I understand the arguments for how we think about paternalism when it comes to all of those type of interventions. But I am actually now struggling to see if we can think about the equality interest versus
Yeah.
liberty one for anything beyond emergencies or pandemics for public health.
I mean, so one way of putting it is that I when we're talking about equality interests, what we're really getting at are concerns about fairness or justice.
Yeah,
And
yeah.
so the idea of people being unfairly singled out for their desire to consume sugary beverages, that could be sort of a cast in terms of a fairness objection in some
Hmm.
ways, where it's like, okay, well, you tax this, but you don't put a tax on other kinds of lifestyle choices that also are
Yeah.
not especially healthy. So, I mean, the classic examples, even though it doesn't apply to as big of a segment of part of the population, are things like, people who like to boulder or do other kinds of sports, which put their own health at risk. Like, we
Yeah.
don't tax those. So this is sort of like we're not treating like cases alike. So that's one
Hmm.
kind of fairness. I mean, equality interest, along the same kinds of lines. I mean, I like the example of soda taxes because there's sort of two objections that often get run together against them that are worth
Hmm.
distinguishing. So one objection is the one that you led with, which is that they're regressive, that they're unfairly burdensome on the least well off. That's an objection from the perspective of justice. A
Hmm.
different kind of objection is what I would call a legitimacy objection, sort of saying what gives you government the right to make this decision about what people should consume. And those are distinct kinds of perspectives. And you see this all the time in public health ethics. So in the Stanford Encyclopedia Philosophy entry, Public Health Ethics, which I'm a co-author of, we suggest that most of the public health literature is either taking up the legitimacy perspective or the justice perspective. Liberty is really associated with the legitimacy perspective. So concerns about liberty are often like, well, what gives the government the right to infringe on my liberty in this kind of way? Don't I have a sort of isn't there a presumption in favor of my liberty to do what I want? Government has to overcome that. Whereas the justice kind of perspective is getting closer to what you're interested in when I'm talking about equality interests. Things about are burdens and benefits fairly distributed? Are we treating like cases alike? So that might be that's the way that's really natural for me to
Yeah.
talk about it, less than in terms of equality interests.
No, that makes a lot of sense. And please bear with me here because this is very helpful for me. So if
Yeah.
I'm thinking about the justice claim, then here it would be very helpful, I guess, as a public health person to find all the statistics looking at like, are we treating different sources that might have comparable harm to each other? So that is one. The legitimacy one is really interesting because when you use the example, and I use that in my class as someone who thinks sugar taxes are actually a very good way to reduce obesity in a population. I use that in class with students because I ask them, like, would you be more in favor or less in favor in the UK versus the US, where the UK has a national public health or healthcare system. So the taxpayer base in general bears the brunt of almost all
Yeah.
the health effects
Yeah.
that you have. But then that, in my head, at least someone comes from a country that had we just had a totalitarian government, and a government that is very much top down when it comes to everything that we do. As soon as I say that, I can hear someone in the back of my head saying, so does that mean like if the government thinks it's providing more and more things for people, they have a legitimacy then to tell me what I need to do? And I guess that then you would fit that under the second component, looking at like what is your
That's right.
legitimacy as a government?
There's sort
Yeah.
of two very different images of like
Hmm.
the illegitimate government that's overzealous when it comes to public health. One is like, yes, a totalitarian state, and the other is this nanny state where it's sort of more like it's an annoyance, it's intrusive, and it's like you don't have the right to do that, but it's not this deep threat to our well-being in the way
Yeah.
that the totalitarian state is. But those are both visions of like a state that's failing in terms of legitimacy in different kinds of respects.
So then let's move to your second paper, and I really want to go back to the entry later on public health ethics, at least at the end, because I'm intrigued to see where you think we can use that entry in public health as we think about the type of interventions we should focus on, what questions we should ask. But before that, let's talk about your 2017 article, which is again dismantling libertarian arguments for vaccine
Yeah.
mandates,
Yeah.
or trying to dismantle, depending on how you want to frame it. So walk us through that paper, what we were trying to do with that paper.
Yeah, so basically, I was reading this paper. It's a really interesting paper by Jason Brennan, influential contemporary political philosopher who self-identifies as a libertarian. He's also one of the authors of a piece that we're critiquing in our lockdowns paper. Brennan was really gracious about me. As you say, I went after him very directly, both to his face and comments and in this paper, and he was really nice and receptive about it. So I read that paper. I was sort of struck that he was saying, look, it looks like libertarians have to face this choice between being libertarians and in favor of vaccine mandates. And then he argues, but in fact, I'm going to make an argument that libertarians should be committed to vaccine mandates. And on that basis, we can see that if libertarians are okay with vaccine mandates. If libertarianism, its core commitments, count in favor of vaccine mandates, then we should think that vaccine mandates are justified, because that seems like that's the position that would be most opposed to vaccine mandates. So he says this, and I'm struck by this because I'm like, I mean, I'm not a libertarian, but what I understand of libertarianism was that these don't seem to mix. They're oil and water. Like, what? In what world is a libertarian going to be okay with vaccine mandates? There's this great quotation from Rand Paul that was around this time. That he said something to the effect of like, it's an issue of parental choice. The state doesn't own the children; parents own the children. And I was like, wow. So the reason why I like that quotation is that libertarians traditionally understand rights as property rights. Him talking about ownership rights. I mean, you can't sell your child. Like, you don't really own your child. But it was like he was embodying this kind of libertarian approach where basically we should understand that all rights, including rights over our bodies, as property rights. So if that's your starting point, if that's what a libertarian believes, then it's going to be hard to justify vaccine mandates because you have such strong rights over your body. What could justify the state in restricting your rights over your body? And what some libertarians have tried to argue is that, well, a libertarian state would be permitted, a legitimate libertarian state could interfere with our liberty if we impose significant enough risk of harm on third parties. So if you go unvaccinated, the idea is you impose sufficient risk on third parties such that you're violating other people's rights over their bodies, and therefore the state can step in and protect their rights. That's why a vaccine mandate is necessary. So one sort of argument that gets made to try to reach this conclusion just focuses on the individual risk of harm of going unvaccinated. So this is an argument from Jessica Flanagan. She compares going unvaccinated to firing a gun in the air. So even though there's no guarantee that you will hit anybody else with the bullet, firing a gun in the air imposes such risk that even a libertarian state would be permitted to prohibit you from doing so. And what Brennan and others have pointed out is that, well, if enough people are getting vaccinated, the risk that you impose on third parties by you individually going unvaccinated is actually quite small, right? And part of what he's getting at is that, well, mass vaccination is about a collective action problem. We want to make sure that enough people get vaccinated such that we reach the threshold for, I'll call it herd immunity. I feel like public health people prefer community protection. I'll just call it herd immunity. We want to get to the threshold for herd immunity. And so we have to appeal to each individual's kind of obligation to contribute to reaching the threshold of herd immunity. And so Brennan argues that, look, we, in addition to having duties to not impose risk of individual harm on third parties, we also have duties to not contribute to collective risk of harm on third parties. And so he gives some thought experiments to illustrate this idea. And he argues that by going unvaccinated, you are participating in an activity, as he puts it, that collectively imposes risk of harm, namely in the form of losing herd immunity, exposing lots of people to measles, etc. And my argument is basically twofold. The first is that Brennan, I think he moves away once you start saying, well, you violate other people's rights when you contribute to collective risk of harm. A lot turns on how we define collective risk. And part of my argument is that Brennan sort of partway through his argument stops making a libertarian argument and makes what I call a classical liberal argument. He basically claims what we should be doing is having policies that promote the most overall utility, and it just so happens that the policies that promote the most overall utility typically don't involve government intervention. But that's not this libertarian picture, I argue, where we have ownership over our bodies, these really strong private rights. That's just basically saying, well, it just so happens government shouldn't get involved in that much. And so I argue the way he defines what counts as acceptable versus unacceptable risk, basically he equivocates between being a libertarian and a classical liberal. But even if you don't accept that charge, I just kind of point out, if you sign up for this argument, there are going to be lots of cases where individuals are contributing to collective risk of harm. In the case of vaccination, why shouldn't it be permitted to prevent us from contributing to collective risk of harm in these other activities? So, for instance, workplace safety regulations. We can imagine that there are cases where people being required to undergo safety training or adhering to certain kinds of safety rules that are imposed by the federal government might very well reduce significant risk of collective harm, but that goes against the libertarian commitment to freedom of contract, which is really important. So there are a bunch of examples like that. So I say, look, libertarians aren't going to sign up for this if it has these implications, which call for this really big role for government in terms of regulating all sorts of freedoms. So libertarians, you're kind of stuck with this choice. Either come up with new arguments, or just go the Rand Paul route and accept that, I guess parents own the children. I mean,
Yeah.
even the collective benefits of mass vaccination aren't sufficient to infringe upon bodily rights.
So I like that article a lot personally. I am I'm intrigued by libertarians. I find their arguments usually to be helpful in abstract, but then it's very hard for me to engage with them in practice. I'm interested in philosophy because as a public health person, I kept thinking, as I think increasingly about what are good arguments to convince most people to do things. I kept thinking, if a libertarian is going to make an argument that lets people get vaccinated, even if it's a false argument, I will take it. So I just wanted to know, like in philosophy, how does it work?
Yeah, I mean, this is often, especially the kind of environment we're in right now when it comes to vaccination. So I mean, this is a slight detour, but I'll get to it. I've written some other papers where I put forward my positive view about what I think justifies vaccine mandates. And my positive view is basically it has to do with this sort of what we were talking about at the beginning, positive freedom, or the freedom to. My co-author and I, we argue that herd immunity is this really important public good because it is necessary for certain vulnerable people to enjoy certain capabilities that everybody's entitled to. So the freedom to associate safely with others, to, all these kinds of things. And people who can cultivate individual immunity don't depend on herd immunity, but vulnerable people do. And so we need to produce public goods like herd immunity in the same way that we need to have like handicaps, accessible restrooms and transport, things like that. That's the analogy we draw. So I presented this, I made my students read my work because, like, why not? They're a captive audience. And one of the students, a really sharp student, at the end, she was like, okay, so, but will this convince anybody? Like, what person right now who's not already on board will sign up? And I'm really sympathetic to that worry. What I'm trained to do is not give the best messaging. I'm trained to sort of make the best argument that I can that appeals to premises that get to an interesting conclusion. That might very well be very different from what's good at persuading the public. I think that there are lots of ethical questions about making arguments that are bad or unsound to persuade the public. I mean, we don't like propaganda usually, even if it's for a good cause. So that, I guess that's what I would say is, I think there are reasons not to engage in propaganda or messaging or to give bad arguments, but I don't know that the one I've given is the most promising one. There might be one that's more compelling rhetorically, even if it's not as whatever philosophically tight.
And to be fair, also to your argument, I know I'm assuming you wouldn't say this, but in your article, you make it also clear that you say, I think I walked through most of the barriers for why a libertarian argument would not fit for vaccine mandates, but that does not mean there might be something there that someone else brings up. I think maybe another way to look at this as well is it's good to walk through an argument from someone who wants to engage more in the debate about vaccine mandate versus someone who might look at this, if they look at it as a propagandist approach from a libertarian perspective, just then discuss it, and then they might actually be able to convince even more people who are more prone to say, okay, libertarian approach are helpful for us to think about our decisions, to say, okay, this argument doesn't make sense, so I'm just not going to vaccinate. I don't know, but I think to be more generous to your
I'll take it. I'll take it. Yeah, I mean, so one way of looking at it is like I'm trying to steelman the libertarian case, and I'm finding that there's not that much there. But I mean, I'm also, this is what philosophers do. This is why it's nice being able to go directly at somebody, because it's usually taken as like a sign of respect as long as you represent the other person's position accurately. And part of what you're doing is you're just exploring the argument alongside the other person, even when you're writing a really critical piece like my libertarianism and vaccines piece. And so I was sort of trying to get into the headspace of libertarians and say, well, what if, you go this route or this route? And even though I mean, showing that no existing argument works is not a proof that no argument could work. But maybe a libertarian can come up with a better one. I mean, this is really flattering myself and making it sound like people are actually reading this at a higher rate than they are. But maybe a libertarian could come up with a better version of a libertarian argument that would be more persuasive, that wouldn't run into the kinds of obstacles as a kind of public messaging that I articulate.
I think in academia, all of us are resigned to knowing that maybe 5 people read our papers, and that's excellent. So no arguments with me on that. So I want to go back to your Stanford Philosophy Encyclopedia entry, where I found that very helpful, because what we're trying to do, Sandra and I, in this project, and we're actually, I think, we're committed to a lot of the we argue for classical liberalism as we think about public health and what are the principles that should guide discussions in public health. Both of us, interestingly, would probably fall into the more left side of the discussion when it comes to type of interventions that are needed. But part of it, we're trying to say, sometimes we argue using the science. Some of the discussions are using the values, but we should think about, are we arguing for our values or the values of the people who are trying to address? So I'm very happy that you're working on a paper that tries to say, like, well, how do we work with public opinion? I would be very interested to see where that lands. What I found useful with your public health ethics entry is just it's at least to me, was a clear understanding of how we think about ethics as we go through some of the discussions in public health. And please feel free to rant here if you want to. Do you think public health people read this? And B, if like, what would you want us as public health people if we distribute this through public health circles? Like, how should thinking about public health ethics intersect with the type of work we do, both in scholarship but also in practice?
That's a really big question. I mean, I think the work of that entry is primarily trying to clarify and outline, here's the landscape and here's a way of understanding the problems that are going to keep arising when we think about public health policy making. Here's the structure of the problems, here are the kinds of solutions that people will be drawn to, and here are going to be the kinds of downsides, the pros and cons of those solutions. So, I mean, as far as, that I think that could be somewhat helpful for people when they're developing ethics guidelines, things like that. So, I mean, I don't expect people who are on the ground doing public policy work to spend their time reading the Stanford Encyclopedia of Philosophy entry, but I do expect that they will look at ethics frameworks from time to time, or they'll get guidelines, white papers, things like that. So I was part of a team that was developing the Hopkins guidelines for how to allocate vaccine. We drew on the SEP entry when developing those kinds of guidelines. So it's sort of like a trickle down effect where hopefully it has some sort of use for people who are doing more practical ethics guidance, because I think that's what, philosophers can't directly provide that. It's just so hard and complicated and empirically messy. You can't just move from here's what this theory of justice says to prescription for this particular kind of case. So I see the tools mainly being useful for people who are kind of at that intersection of public policy and coming up with ethics guidance. So here I'll take you up on the offer to rant. I think that public health folks that I've interacted with, they are very aware of the justice kinds of concerns that we outline in that entry. They're aware of worries about regressive taxation. They're aware of stigmatization. I think they're less sensitive to some of the legitimacy kinds of concerns that I raise, or that we raise in the SEP entry. In particular, I think there's some versions of the legitimacy worry, like the libertarian version, which is really focused on liberty and the importance of respect for liberty. There's a different version, though, that is really focused on, well, I mean, who are we to say what's best for people, right? There's a real risk of public health. It's not that they'll infringe on your liberty. That might be a worry, but it's also that they're imposing a view about the good life where health is above everything else. And I think this came up when we were talking about the soda taxation. It's like, for some people, soda has really significant value, even though it comes at a cost in terms of health. And so for different people, how they value their health relative to other kinds of goods is not going to be straightforward. And so when we're interfering to try to promote population health with people's choices, or changing their choice architecture, or doing whatever it is you mentioned the Nuffield ladder of interventions, like whatever it is, there's a real worry about legitimacy, that we're imposing our view about what makes for a good life in a way that we don't have the right to do as public health, as government people.
No, I really like that answer, because even I struggle with it. And with my students, I give an example about someone who might be 75 years old, 80, who was someone working construction, let's say, just have a lot of aches and pains. And having a cigarette per day seems to be the one thing that it just makes them very happy about their lives. It is very hard for me to argue at an individual level that I should tell them, you know what, you should stop smoking. That's the thing that is going to improve your life. But it seems like I guess that's part of most people, or all people who got into public health. I think they care about improving health. So we always think of it as that. That's the goal. That's the main goal that we need to achieve. So that is very hard for us to engage with. I'm glad you ranted about that, because I do think we need to hear more from other people. So quick question. I know people in philosophy usually like thinking about something thoughtfully, so I think it might be great to just ask you something and have your response on what is the best policy in 2 minutes. We ask people to wear helmets. We require helmets if you're on a motorcycle. Why can't we require people to wear a helmet in a car? A. B, even beyond helmets, what is stopping us from public health from imposing just a federal guidance that every state implement Waymos as the standard way of driving around cities, because we know Waymos or self-driving cars are much, much safer for people, given that traffic injuries are increasingly a big part of the morbidity and mortality in the United States. Like, what would be a philosophy argument for or against that?
Tell me which side to pick. That makes it easier. No, I mean, so one way of responding would be to you say, since we do allow people to wear, I mean, we do allow the government to mandate helmets for motorcycles, why can't we also do it for cars? I mean, one really natural way to respond to that is like, well, we shouldn't allow the government to mandate helmets for motorcycles. I mean, to be clear, mandating helmets for motorcycles is a huge gain in terms of, yeah, I'm not a skeptic about its efficacy, but it's sort of like, well, if some people want to take that risk with their life and they're not harming third parties, then and this is where people naturally want to appeal to the harm to third parties, right? Where it's like, well, what if you swallow a bug, or what if you get launched into somebody else's vehicle, or what if you use up these scarce? I mean, these kinds of arguments, which to me are kind of thick leaves, because it's really just about protecting people from destroying their brain. That's the real huge harm. So one response would be to say, well, we've actually erred too far in the direction of restricting liberty. I think for kids, it might be easier to make the kind of helmets in cars case if I mean, I don't know anything about the data you're pointing to, but I mean, for kids, we don't think that parents are allowed to put their kids at undue risk. If we think that the risk profile is high enough to mandate that children have to be in car seats or wear seatbelts, things like that, then why not go a step further with helmets? Other than it just feels really intrusive. I mean, people really didn't like being told to wear masks, even though that, so that's one response. I mean, I think the other thing you're bringing up, the self-driving cars. So part of it, I mean, a really natural kind of response is like, well, people should be free to do this activity, even if it is risky. I think another part of the opposition, though, is interestingly different. It's not just this liberty interest. People have really strong intuitions. Like, imagine a self-driving car kills one person. They're far more upset by that than, like, a regular automobile. But this is the same. I mean, we see this throughout with AI sorts of things where, people, you see all these reports about this person died by suicide after using AI as a therapist, even if they're using like a designated bot or an AI therapist. It's like, well, patients die by suicide when they're seeing a human therapist too. And so there's sort of this to me, philosophically puzzling thing where it's people get much more upset when the death is caused or is seen to be caused by AI than a regular human. So that's part of the opposition there.
I used the exact 2 examples for someone talking about automation 2 days ago.
Oh, yeah?
2 days ago, about AI as a therapist and Waymos, and just thinking that people very clearly don't like it. Like, it's just going to make the news if a Waymo hits one person versus, I don't know how many. St. Louis have one of the higher traffic incidents in the U.S.
Yeah.
None of those make the news. If a Waymo comes to St. Louis, kills one person, that's going to make the news. And
totally.
Yeah.
Yeah.
So Justin, there's one final question. As you do this work, and I'm very much appreciative that you're doing more work on public health justice, I am truly excited about the public opinion piece. We're thinking a lot more about this just also because public health increasingly talks about needing to work with communities, just not having anything that is top down. And it seems to me that it's becoming more of a buzzword versus understanding what does a democratically or what is a good approach to actually taking the public's opinion instead of just thinking about like who has the power to enforce public health interventions. But if there's one space that you would want us in public health to think more seriously about moving forward, especially given increasing fissures on who trusts public health when, and it seems now that really it depends on the party. If one party is in power, the rest of the country doesn't trust public health, and the other way around, which at least to me doesn't seem like a good way to manage the public health. So what would be a question you want us to take seriously in public health moving forward?
I mean, obviously, I care a lot about like vaccination and thinking about justifications for vaccine ethics. But I mean, I think y'all are on that. I don't think that's a neglected topic at the moment. I mean, I guess one thing I will say is I've been thinking a lot about what does it mean to engage the public when it comes to these kinds of really difficult questions, which seem like they're questions for experts.
Yeah.
So this project that I've been on, we've been looking at how did governors consult the public when it comes to making decisions during COVID-19. And some folks they've called for the use of like mini publics, getting a random selection of the public that's representative and having them deliberate. And I'm kind of skeptical that they're the best tool for that in an emergency context, but they do that kind of tool, I think, has a lot going for it, both generally, but also potentially at breaking down polarization. So, they get convened to deal with issues where people are taking knee-jerk responses and people change their minds by the end. Maybe trust is too far gone for them to actually be useful in this way. I mean, that's the really pessimistic outlook, but using those more and getting ordinary people to just sort of talk to each other and hear from a variety of experts, that might be one way of helping to restore trust in public health and getting outputs that are actually also like quite sensitive to lots of different considerations that might be overlooked if it's just a top-down kind of process.
Justin, thank you so much.
Thanks, Selma.
This episode was edited by Catalina Melendez-Contreras with marketing and outreach by Kinkini Bahaduri. The podcast is supported by the School of Public Health and the Frick Initiative at Washington University in St. Louis. You can find Complicating the Narrative wherever you get your podcast, and you can also watch the episodes on YouTube. If you found this conversation useful, rating, sharing, or recommending the podcast is one of the best ways to help us reach more people. Thank you for listening.